Hi, my name is Jessica Moscoso. I'm going to be talking to you about cirrhosis of the liver today. Cirrhosis of the liver is the 12th leading cause of death in the United States. It's more common in men than women, and it also kills 32,000 people every single year. There's no cure for cirrhosis of the liver, but there are treatment options available depending on the cause and the severity of the disease. I've been in the field of gastroenterology for 8 years, 5 of those years as a nurse. I'm currently a director at a multi-specialty surgical center with gastroenterology being our main specialty of care. I'll first be discussing what cirrhosis of the liver is, followed by the causes, and lastly, the treatment options that are available for these types of patients. So let's begin. Cirrhosis is scarring of the liver. This is what a normal liver looks like and a cirrhotic liver looks like. And this is where it's placed at in your body. Cirrhotic liver doesn't have a good blood flow like a normal liver. A liver is supposed to be like a sponge, like this. It's soft and spongy. But when cirrhosis sets in, your liver hardens, like this. It's more dense and diseased. This is what cirrhosis of the liver looks like. Now that we've briefly discussed of what cirrhosis is, let's move on to the cause of cirrhosis. There are many causes of cirrhosis of the liver. I'm going to go over a few of them and the main points of them. Alcohol is number 1. Hepatitis B and C is also a cause of cirrhosis of the liver, followed by medications. Chronic alcoholism, like I said, in adolescents and adults are the number 1 causing of cirrhosis of the liver. Hepatitis B and C are viral infections where the liver is damaged. And NASH, which is non-alcoholic fatty liver disease, is caused by obesity. There are also different genetic disorders as well as medications and bile duct diseases. Some genetic disorders include autoimmune hepatitis, where your body has good cells, but your body thinks that it's bad cells and it attacks itself. There's also hemochromatosis, which is a genetic disorder where your body has too much iron in it. It's an iron overload in your body. Some of the drugs and medications that have been directly linked to cirrhosis of the liver are steroids, methotrexate, Depakote, and also aminoterone. Those are just some of the few medications that can cause cirrhosis of the liver. Now that we've touched on the causes of cirrhosis, let's go over the treatment that is available for the patients and that they may live a normal life to the fullest. Treatment of cirrhosis varies depending on the underlying cause of cirrhosis. So for example, if it's alcohol, the patient obviously needs to stop drinking alcohol. Even if they need to enroll into Alcohol Anonymous, that's what they need to do. Chronic hepatitis B and C is also an underlying cause of cirrhosis, as I mentioned. Treatment of those hepatitis, there are appropriate supporting medication regimens that are available for that. NASH, which is the non-alcoholic fatty hepatitis I mentioned earlier, that is treated by diet and weight loss, daily exercise, low-fat diet, low-sodium diet. There are some new studies out there about stem cell research and also skin cells that are actually making into liver cells to help, but we're not quite there yet. That's still under progress. So to make a conclusion today, cirrhosis can be a very deadly disease, but if it gets recognized and diagnosed early on, it can be treated and it can be prolonged by various ways or even prevented. As healthcare professionals, be alert and aware of these underlying diseases and what they may become. I hope you all enjoyed my speech today and that this information will be helpful throughout all of your careers. Thank you.